Well, good evening, everybody. My name is Field, and I'm going to talk to you about the multisystemic therapy. Multisystemic therapy was founded by Dr. Scott Hengler in the mid-1970s at the University of Virginia. He was given a caseload of the most violent youth offenders. He was hired by the State Department to work with them, and he would bring them into his clinical setting. He was making very little progress with them.
Okay, can you go back to that? What was
Hengler,
Hengler?
H-E-N-G-G-E-L-E-R. And that is a recent photo of him.
You see, that's German, right?
Yeah. So he was working with youth in his clinic, and he was making very little progress. So he came with a great idea to go to their homes to see if he could connect with the children better there. Within seconds, he realized that the homes were a good, the majority was, had a big part of the problem of the children's antisocial behavior. At this point, he moved to the Medical University of South Carolina, where he and his team further developed his philosophy of taking therapy to the home. And multisystemic therapy was developed. Multisystemic therapy deals with not just the children, but where they live, they hang out, their school, and their community. It is named this because it addresses the different systems in the life of an adolescent. It is intensive, family-focused, and community-based. Generally, children youth that are involved in this program have an extensive history of criminal behavior. There are variations within multisystemic therapy. They deal with some substance abuse, problems with sexual behavior, abuse and neglect received from their parents to the children, psychiatric disorders, and a range of serious behavioral issues. There are 9 principles in multisystemic therapy. The first one being finding the fit. So the primary purpose of assessment is to understand the fit between the identified problems and their broader systemic context. What this is the fit within their environment, being their home, and this helps guide the treatment process. Number 2 is positive and strength-focused. Therapeutic contacts should emphasize the positive and should use systemic strengths as levelers for change. They emphasize the positive with these kids. They try not to focus on the negative. Anything they can see within the home or that the child does that is positive, they focus on that and they try to just kind of build upon that. Yes.
So he saw the difference right away as soon as he went.
Well, dealing with the whole family, not just the child. He saw that if you work with the child in the clinic and then you dump them back at the family where the family is they're doing drugs or they've got anger issues, it's not the child will not benefit. All right, number 3. Increasing responsibility. Interventions should be designed to promote responsible behavior and decrease irresponsible behavior among the family members. So they do focus, like I said, mostly on the family at home. If the parents are doing drugs, they try to get the parents into some sort of drug program. They try to keep the families together at all costs. It's present-focused, action-oriented, and well-defined. Interventions should be present-focused and action-oriented, targeting specific and well-defined problems. They focus on the now. They want to deal with what's going on right now. They try to teach the parents not to focus on anything on the past, because that's not going to help anybody to keep bringing up the things that they did. If the children do something good, they want to focus on that now. If they mess up, they need to deal with it right now and make any kind of changes in the way they're working with the child and family. All right, number 5, targeting sequences. Interventions should target sequences of behavior within or between multiple systems that maintain the identified problems. So that means dealing with their family, their teachers, their friends, their home, their schools, their community, anything that sustains that they can identify the problem with. Did I skip 6? Yes. All right, developmentally appropriate. Interventions should be developmentally appropriate and fit the developmental needs of the youth. Basically, what works for a 17-year-old boy is not going to work for a 12-year-old little girl. So they want to definitely be age-appropriate with these youth that they're working with. All right, number 7. Continuous effort. Interventions should be designed to require daily and weekly effort by family members. With the multisystemic therapy, these therapists and the whole care group is available 24/7. If something happens at 2 o'clock in the morning, the family can call the team and they are there. This is very intense, working with the family.
I think you have a question.
Yes.
What would the income level be of these children? Would it be low income?
The demographics, they actually did several different studies. A lot of the studies that they did in the United States were generally in the lower income. They did do some, they use this technique in Australia, Switzerland, Canada, like 14 different countries and in 31 different states. The control group that they used in Canada did not work as well as the groups in the United States. Mostly they figured because it was a higher socioeconomic level. And it is a family base, and perhaps the families that they used in the United States benefited more from the help, and they were able to gel together more as a family, whereas if you work with a higher income, it's kind of hard sometimes to work with somebody who's
It's really
Thanks,
popular
Howard.
with the criminal justice system because of the transportation issues that a lot of clients have. They don't have cars, they don't have. So because this is done in the home, the POs like it a lot because they get to go to the home. It's another set of eyes in the home, and they're really bend over backwards to work with the family in their environment. So it's really popular with, even here in San Antonio.
Mm-hmm. Yeah. Evaluation and accountability. Intervention efficiency is evaluated continuously from multiple perspectives, with providers assuming accountability for overcoming barriers to successful outcomes. What's really important with multisystemic therapy, they do not label the family. If the family isn't progressing well, or there's some sort of barrier, the team does not say in the report the family is not responding. The team takes it upon themselves that they are failing in some way, and so they find different avenues to work with the family. They do not label the family. I think it's just really beneficial for the family to not get another label. I'm sure they're used to it, and they really, I think, respond to the team because they see that they actually do care and they want to have positive results. Number 9, finally, generalization. Interventions should be designed to promote treatment generalization by long-term maintenance of therapeutic change by empowering the caregivers to address family members' needs across multiple systemic contexts. The team teaches the caregivers and the parents to work with the kids. Like I said, it's a family-oriented program, and so when the intervention is finished with the team, they hope that they've left the caregivers with enough tools and knowledge to continue on with the child. So what is MST? MST realizes that it needs to address all environmental systems that impact chronic and violent juvenile offenders. The cartoon says, maybe if we hadn't shot all of our little friends, we'd have someone to play with now. Comparison to other services. They took 84 offenders who were assigned randomly to treatment services in 2012. Pre-treatment and post-treatment assessments, batteries, evaluated families' relations, peer relations, symptomology, social competence, and were completed by the youth and the parent. So the youth and the parent wrote down everything that they thought they needed to work on. Archived data was researched at 59 weeks post-referral to obtain data on rearrest and incarceration, and compared to offenders who received typical services, youths who received MST, which is multisystemic therapy, had fewer arrests and self-reported offenses. They spent on average 10 weeks less time incarcerated. Family relationships. Families involved in MST reported increased family unity and decreased youth aggression in peer relations. Multisystemic therapy focuses on the entire family, giving attention to the parents to help them overcome some of the problems they may be facing. This being working with anger management, it gets them in touch with people to help with their anger management problems. If the parental or the caregiver has problems with substance abuse, they're not going to just yank the parents. They work with the parents to try to overcome those problems. They also work on their communication problems. Communication is key. If you can't communicate, you're not going to get
Do
very
they
far.
work with them together? And I'm thinking, let's say the Do they work with the father, the mother, and the kid all together to address his problems, or separate and apart?
I honestly don't know the answer. I would assume separately, just because age appropriate. I would assume separately, but I do not know the answer to that. I do apologize. Incarceration is not a solution. Imprisoning youth is just an illusion of safety. When they are released, more likely than not, they will be back in the same old gang, doing drugs, breaking the law, and doing violent crimes. So often they incarcerate children and they come out of there better criminals than they went in.
Hey, man.
What? Don't mess with Elmo, man. He's packing.
That was the Muppets with the West Side
agree with
Story.
It's got a beard, it's like a Corona. Yeah, we got Grover and Cookie Monster.
Smarter than we think.
I think Grover, I mean, he must have had a shot.
That's Texas.
Yeah.
Yeah, Big Bird, Big Hat Snowman. Yeah, he's passed out with Snuffy. They were on a bender last night. Didn't make it put him up. All right, proven results. MST clinicians are available 24 hours a day, 7 days a week to give advice and support should an emergency arise. So that is a lot of responsibility on the team. You need to be available. It takes a special kind of person to kind of commit that kind of time.
No social life.
No social life.
Well, and usually what it is, you have several clinicians, and it's like an on-call.
You alternate?
Rotate.
maybe?
Yeah, so
You rotate.
Yeah, there's a
it's
team,
allowed
not
to
just
do
one.
Yeah.
How many are on the team? Depends.
Yeah.
Oh,
It depends on the,
Area.
Yeah, the area and how bad the kid is and maybe how bad the family is and how much work.
Usually if you have a program, you have several teams,
Three to
anywhere from
five
two to five teams, therapists, case managers, family specialists, so yeah. there's-
Whichever one, they'll be,
Would the one therapist stick with the family, or like, and when they're on call?
Usually the therapist, when they're on call, they're rotating, the therapist is the only one, the therapists on the team are the ones that are on call.
Oh.
The case managers transporting, you know.
Okay.
All right. So before treatment, these teens, ages between 12 and 17, male and female, were stealing, doing drugs, selling drugs, beating up their parents and siblings, breaking into houses, rarely showing up to school. These were very naughty children. It says, watch for children, there's a little old man and a bunch of kids are ready to rob him. And it didn't look like that on my. All right, so we were breaking the cycle. Multisystemic therapy has proven to break the cycle of criminal activity with youths. Up to 59% fewer rearrests after the program, up to 68% fewer days incarceration, up to 57% fewer drug-related arrests, and up to 43% fewer days on adult probation. MST saves money. According to the Justice Policy Institute, states facing budget shortfalls could save millions of dollars while improving public safety by investing in community-based youth interventions and outpatient services like multisystemic therapy. 93,000 incarcerated U.S. youths at $241 per day. MST is a fraction of that cost, and the youth is less likely to commit future crimes. So who are multisystemic therapists? How do you become one? You must have they are full-time master's level staff or bachelor's level staff with a minimum of 5 years appropriate clinical experience in mental health or child welfare services. Therapists are assigned to the MST program solely, and they have no other agency responsibilities. That is what they do.
Yeah, that's not very popular.
Perfect.
It's not very popular?
Not with agencies, they like
maybe more, right?
multi-assigned.
And that is the conclusion of my presentation. Do we have any questions?
Oh, man, it's over already?
Okay,
What
go-
is the time frame on that? Did you say?
How long they're in? It just varies.
Yeah, is it short or long, like 3 months to a year? It just depends.
Yeah, it could be. I think it would go closer to 3 months to
Yeah, 6
to 6 months.
Yeah.
Yeah, 10 to 12 weeks, one session per week, the average is between 3 and 4 months,
3 or 4 months.
depending on the sessions.
Or how long?
Once a week,
Once a week, so that's the time frame?
10 to 12 sessions.
And is there as much
For an hour,
in
60 minutes?
the lower income